In the future, we hope every hospital or country have their own sequencing ability, and Visualize is a good tool to do that. I'm Nina Lee, and I'm working on a diagnosis of rare disease patients using short-read or long-read sequencing. If we use traditional test, diagnosis of rare disease will take time, and baby in PICU or NICU, for example, they count every minute. So it is important to have a turnaround time within days. And Nanopore can provide this. Currently, we use P2I. It decreases the need to have a sequential test. So it provides a more convenient and comprehensive way for molecular testing. Nanopore sequencing is a good tool to provide one test for all strategies. So we think in the near future, it can be able to be the first line genomic testing tools for NICU or PICU patients.